Well, it looks like we're live. It's funny. I think between Facebook, Zoom, and the restreaming service that I'm using, we're seeing probably a little bit of a shift on a daily basis of what's going to happen for the feedback for when we're live here. So I'm always thankful that at least the first couple of minutes for the show tend to be more awkward, but also less viewership. So although I will note that I've heard from plenty of you lunatics out there that you watch the replays. So I'm sure you get to enjoy yourself on this entire bit here. So I'm going to try to start my watch party here. That normally I use my co-host Mike Loaf in an opportunity to kind of fill in that gap, but we are live. So I think oh great. Let's try this again because I was and I'm gonna turn down the volume because I just blasted my own speakers accidentally, and I don't want to blow out any of the lunatics' eardrums, but it seems like now is a really good opportunity to start the show. And gosh, you'd think after 3 months of this that it would be a little bit easier. As I get a phone call too. It's what a mess. Mike Loaf, where are you? We're putting out the bat signal. And you know, we're pretty big fans of bats here, and maybe we'll see that happen here during the show as well. Welcome to hotlou Happy Hour. I am your host, Lou Abramowski, or somewhat messily known as hotlou. So we're going to talk about a handful of things here as we navigate through another hotlou Happy Hour without co-host Hot Mike number 3, who has now been fully rebranded to Mike Loaf. But the very first thing I have to mention is the fact that it looks like Yeezy is very serious. Kanye West is very serious about his candidacy. He's rolling out merch. He is disavowing his support for none other than the current president. And this is great because I'm seeing the phone call that I got for just a moment ago, now joining the show live, recognizing that the question he has, he's probably going to have to ask live. Maybe we need to do that in the watch party here. But yeah, Yeezy's out there. He's ready. So I think a good place to start is maybe jumping out of the poll. But I think the big question on whether or not Yeezy is going to run, or what the impact of him actually running for president of the United States is, how does this affect the actual outcome? Oh, and look, we have Hot Mike 3 in the house. Mike Loaf, you're here. But I can't hear you.
I'm a short timer, Lou. Oh, am I on mute?
No, you are. I can hear you now. This is terrific.
I got my mask on. I don't want to spread the COVID through the internet, but I do. So, to hell with it. All right, you're all at risk. You've signed a waiver. There we go. Bandolero for Lou. Oh,
yep.
Fine.
Yeah, we could do the whole show this way. Well, I thought I could.
I'm a short timer. I had a meeting that went long that was supposed to start at 4 that wound up starting at 3. And now I have a meeting that was supposed to start at noon that's going to start 5 minutes ago. So I just popped in to say hello. And I hear you're talking about Kanye, who's currently getting my vote for president, by the way.
Well, that's the question I was just about to pose for the lunatics, is like, what will the impact be if he continues to pretend like there's a serious opportunity for him to get elected?
Oh, Lou, there's no serious opportunity for him to get elected. But that's not the only reason you cast a vote.
Yeah. I'm not saying that I think he has a serious opportunity to actually take office, but if he treats the campaign seriously, what impact is it going to have? Meaning, are we going to see people who would have ordinarily voted for Biden to switch over their vote for Yeezy? So is it going to be the fact that he had, up until yesterday, as far as we know, been supporting Donald Trump, are there going to be people who now jump over from supporting Donald Trump over to Yeezy? I mean, I already know the question or the answer to the question, but I'd like a political wonks take on this.
The 6 people who vote for him will be people who would not have otherwise voted.
That's a good point. I wonder if there's an opportunity for him to actually draw out more voters, and as they get to the poll, they second guess themselves, and maybe it actually draws in a couple more votes one way or the other.
Could be. I think that his voters will come from a pool that are not in the camp of either candidate. And like I said, it could be me. I'm not in the camp of either candidate. Now, the only reason I would vote for, and when did he become Yeezy, by the way? I don't know what that is, but for Kanye is if I just become fully resigned to the fact, as I've said on this show multiple times, that politics has just fully been merged with entertainment, which I think has been happening for quite some time. There used to be a saying, Lou, that politics was Hollywood for ugly people. And I'm not sure that, and maybe it is, and maybe it's still Hollywood for ugly people, but the point is it's still Hollywood. You're still seeking the same things out of service that public service that people are seeking by becoming stars, by going and auditioning for sitcoms and whatnot.
Yeah. I have a feeling that he is going to actually take this seriously for a while, if not all the way to November. Because it tends to be his way. And I think we have talked about it. I can't remember if we talked about it on the show, but it kind of felt like Donald Trump did the exact same thing, where he was like flirting with running for president for like 3 decades, or at least pretending. And then slowly but surely there was this momentum growing one way or another. And then it was like accidentally he became the candidate, and he was just like fully committed at that point.
Yeah, well, we saw this in Minnesota, right? I mean, this can happen.
Yeah,
it doesn't often happen twice in a row. So for those who are in the Yeezy camp, calm yourself down. This is not likely to reoccur. Now, be interesting to transport yourself back in time, and I'm gonna have to go here because I'm already late for the meeting that I was supposed to. My schedule's back to what it was. Like, we're out of the pandemic. Pandemic's been canceled. It's over. We're back to doing things. But anyway, the pandemic's over. You don't get to redo it. You don't get to redo 2016. Probably your 2018 candidate. Yeah, it's over. I don't care what that says. That's all a bunch of garbage, hot garbage. Actually, now I'm kind of interested in that. What is this? RT?
Yeah, I was, our chief, and I emphasize the word chief, fact checker, Josh Kimber, out of Chanhassen. Gosh, and I feel bad because I can't remember if it's Chanhassen or Chaska, but he just shared this.
Chanhassen.
Chanhassen he just shared this really interesting thing, which I think, he shared it this afternoon, and I hadn't seen this before, but it looks like it's a Twitter-owned site that is up-to-date values for this RT, which I think must be some derivative of what was previously called the R naught, which is basically how R or R naught, the number of people who are getting infected additionally for every individual who gets infected. So basically what you want is this number to be below 1, because if one person gets infected, it means that in Minnesota's case here right now, for every person that it gets infected, 1.26 people also get infected. And that's just on average. I don't think that actually references 26% of any individual being infected, or at least I hope not. But we don't know. Like, we saw the bubonic plague now had a case in near Mongolia in China. So all the rules are broken at this point.
Bring out your dad.
Yep. So,
but show me the ICU rate. Show me the hospitalization rate, because people getting infected is not interesting to me. I feel like if I've been consistent on anything on this show, is that infections is the almost irrelevant.
Yeah, and I would really love to see some sort of cross section here on, again, the age range, because that's really, like you said, the number that matters. And Chief Fact Checker Josh Kimber has been really valuable in this because he's been able to source some of this stuff, that the number one demographic right now that's being infected is the 20 somethings.
Yep.
And as we've seen, we see very low hospitalizations, we see very low deaths from that group. And as we have commented a couple times, we see that the 20 something year olds, or even, as you get into the 40 somethings like us, we seem to be doing a better job at least isolating ourselves from the most vulnerable, those with comorbidities, uh, you know, severe diabetes, severe obesity, old age or immunocompromised situations. And that might be one of the things that's really driving down the hospitalizations. While I think we surged past 3 million positive cases, now many of those have recovered in the United States, and we do see these hotspots where ICU rates in not the expansion ICUs that can be built over a couple of days, but we are seeing nearing 100% ICU capacity. Not that there isn't.
Google the comments and I do have to go. I'm sorry to
Yeah.
drop in and hijack the show. Google the comments of the Houston medical director of the Houston hospital. Are you familiar with this?
Yeah, I think we talked about it. I can't remember if you were on the show, but yeah.
Because he talks about how we routinely run at 90% capacity in our ICU. He's like, that's not unusual. Yeah, okay. That's maybe the one that, and it's sort of like, I still can't divorce myself from the idea that we are not getting the full story here. We are not getting a reasoned approach. The news is not giving us sort of, here is what's happening, devoid of trying to have an emotional impact on me. And so I just went to the Minnesota.gov COVID-19 response page, and we are still at less than half of our ICU capacity. I'm talking about now the 72-hour ICU capacity. So we're still at about, I guess that would be a little bit, about 80%, give or take 75%, 80% of our original capacity. So if you remember all the way back to March, this was the goal. The goal was to make sure that anybody who needed a hospital bed gets one, and we're still well beneath that goal. So if the 20-somethings are getting infected because they went to protest without their masks on, I mean to a bar, and they're largely presenting, and by the way, now we're testing at 10x the capacity we were testing, or 100x the capacity we were testing 3 months ago. I'm not concerned. I'm not concerned yet. And they've lost my trust as far as being honest brokers of what I should genuinely be concerned about, because they've not been covering this appropriately, and the government has not been largely has not been reporting this without their spin.
Yeah, we've
trod this ground. I mean,
we have. And I don't think we're persuading anybody, but like the fact that ICUs are not really being overloaded at this point, that doesn't really, I think, assuage the pain that we're talking about 130,000 deaths here. But what we are trying to do is try to minimize the harm and avoid the path of worst harm until we have real therapies, until we have a vaccine in place, because that's still a little bit of ways away, but we have improved therapies.
We do. I'm glad you're bringing that up. Getting diagnosed and even going to an ICU with COVID-19 on July 8th is a hell of a lot different than the same scenario on April 1st.
We have so many weird little things, like literally people are being just placed on their stomach when they get vented, and that's helping save their lives. Remdesivir is actually showing some promising results, as is bizarrely hydroxychloroquine, if it's administered at precisely the right time for the right people. So it took time to evaluate these things to help people survive. So we're seeing much higher survival rates.
What does the medical journal report on sunshine, on consuming large amounts of sunshine?
If what you can do is if you can sit close enough to an amplifying device and shoot it right into your veins, COVID's not an issue for you. And filter it through some bleach.
I'd like to tell you about my lamp. because this lamp will put sunlight. Look at it. Look at if I'm watch this, lunatics. Okay, I'm COVID.
Do you want me to just point here? Let me point it at you. So, oh yeah, you seem cured, if not like, if
I'm better. I'm better.
All of the virus.
I went from COVID to a lottery ticket. Like, you're not gonna win, but you might win.
Yeah. Okay. Well, I know you have to go.
I'm neglecting.
I'm curious if you want to share any sort of topic or opinion on the fact that this is totally expected, and I can't believe it's been so late. But reduced stadium capacity for all major sports is not a surprise at all, right? We're going to see very close to empty stadiums. Even if they allowed the full stadiums to show up, I think people are going to self-govern and not show up to these games. One thing that was running through my head yesterday is I'd be very curious to see what happens is the NFL Sunday ticket or some sort of blended pay-per-view that we see with other sports like MMA.
That'd be really interesting to try to get money out of it. Yeah,
exactly. And that's something that I would be very interested in doing. If I could just piecemeal a couple of games a week, if I just could pay for 2 games that I wanted to watch per week, I would probably do that instead of just the NFL Sunday ticket.
Yeah, agree. I can't believe this is this late. I don't think there's a person left in America that thought that maybe there'd be full stadiums, at least in the early part of the season. So good on the Ravens. I hope the Vikings follow with some kind of a plan. At this point, we just need a plan because we're not getting it from our elected officials.
Yeah.
So I got to go.
Okay.
Love you, lunatics. I'm sorry. This is what it is today. Life's getting back to normal, and that means stuff is weird.
All right. Thanks for checking in impromptu, Mike Loaf. We appreciate it. And I'll try to carry the show without you. And maybe we'll see you tomorrow.
All right. We'll see you tomorrow. No bats. Bye.
Bye-bye. Okay. Sorry, Chief Fact Checker Josh Kimber, for not getting that question. I didn't see it until a little bit too late here. But I love to see the lunatics commenting that Yeezy will have no impact on the election, because I totally agree. Now I'm curious. I'm going to throw this up here in the comments or in the poll, because I'm pretty curious to see what your thoughts are on watching sports, because one of the things that I've seen now, and is totally not a surprise, but we have lots and lots of people protesting sports in a new way. Like, they're not only saying sports aren't for me, but I am going to shame you if you're supporting sports in any way. And to the point that Mike and I were just kind of talking about, it's really fascinating to see that people are starting to survive at a much higher rate when they do get diagnosed with COVID. And we see that the people who are being infected at these skyrocketing rates are the people who aren't necessarily going to become hospitalized or suffer the long-term effects from it. Not to say that that won't happen, but we're in this spot again, and I'll repeat it probably until we have a vaccine. But right now, all paths lead to harm. And we're just trying to avoid the one that's the worst on incomplete information. And I'd be curious what you lunatics think, and leave it in the comments if you're not seeing the polls. But are you in support of sports resuming so that you can consume that? So how do I want to ask this question? So better way to say it is, are you going to protest sports resuming? Yes, no, or it depends. I'd love to hear your opinion on this, lunatics. I'd really like to understand what your thoughts are on this, because we're seeing it in the ultimate community in a pretty strong way. So ultimate Frisbee players, there are pickup games starting to kind of pop up. And by the way, several of them are, within the CDC and state guidelines. And yet we still see a very large component of ultimate players trying to shame the ultimate players who are doing that. And I understand it. And, I was definitely in that camp a couple of months ago. But what I kind of am starting to see is that these people who are most, the ones who are most vocal about that don't seem to be trying to follow along with the updates that are happening. They've never even heard the term remdesivir. They don't know about the improved ventilator situation. They don't really see that the mortality rate is in decline. They don't see that the people who are being infected are a very different demographic than what had happened a couple of months ago. So I'd be very curious to hear what your thoughts are. Are you out there shaming people? Are you out there, hoping that sports will resume so we can be entertained? Are you hoping that you can not only consume the sports content, but also consume it in maybe a different way? Because like I said, I don't think I've ever bought the NFL Sunday ticket. Maybe I did a long time ago, but if I could do a la carte games, and even watch a game over like a local game over the antenna or something, I'd be very curious. And I'd like to hear from Chief Fact Checker here, Josh Kimber, on whether he's seen anything on whether this is going to impact blackouts in any way. Are we going to see full stadium, a stadium that is allowing full capacity to still follow the blackout rules if people don't actually show up? Because that's been on my mind too. And maybe there's ways to overcome that. Maybe we'll see what we saw, back in the late 90s when those blackout rules started with the Minnesota Vikings. We'd often see sponsors come in and buy the last 2,000 tickets to sell out the stadium, but they didn't necessarily even go, but they bought them out in a way to get the press so that it would end up broadcasting the game. I'd love to hear your take on where you're kind of fitting in on all of this stuff, lunatics, because I'm starting to see that, like I said, especially people who are in this camp of, they made up their mind 2-3 months ago based on very real data, but it was incomplete data, and it's only become more incomplete, having an opinion that is unchanging. And I think in a time like this where we are going to start seeing a flood of new information here, as more and more treatments are tried. A vaccine trial literally started in March. So we are 4 months, I think we're a week or two out from 4 months within the very first vaccine trial. So this stuff is going to change dramatically. And if you're not on top of that, but you're out there shaming people, I feel like you're actually causing more harm than any sort of good, even if your intentions are good. And I even had a conversation with somebody about this morning who shared this, there's so many people continuing to share this stupid, and this tends to be on the other side, the stupid notion that the COVID deaths are being massively overcounted by people who are dying in car accidents and being tested positive for COVID. That idea was popularized by a guy who did not read the CDC guidelines closely enough. He was out there spreading rumors. He was on the Hot Lou happy hour, and I tried to, as diplomatically as I could, grill him on it. And it turned out he just didn't know some of these facts. There's still people out there pushing this narrative forward, despite the fact that, there might be a couple of death certificates out there of like drug overdoses or, a couple of other accidents where people did die of COVID. But it doesn't appear on their death certificate as the primary cause. They are still being counted, but that's because those people may have survived that drug overdose had they not also had COVID. So it did contribute to their death. But what we're not seeing is hundreds of these death certificates, and we're certainly not seeing tens of thousands, which would suggest that we're somehow massively overcounting. And my response to this person who was sharing this was, did you read the CDC guidelines on the specific data that the person that popularized this idea drew the conclusions that caused this conspiracy theory? And their answer was, I don't need to read them. I've done the research. And the massive hypocrisy in just one tiny little sentence drove me crazy. And there's no fixing it. There's no fixing it because it's a document that's like 7 pages long and it's super easy to read. And if you claim to have done the research and you haven't read that document, I don't think you have any sort of place engaging in the conversation around all this. And the same goes true, by the way. I think if you're drawing conclusions on this stuff, if you can't understand what, God, and I keep forgetting that. So we have specificity, prevalence, and specificity, prevalence, and I keep forgetting the other term, but it has to do with the positive, the false negatives, the false positives, and the actual amount of people being tested. But if you don't know how the false negatives and false positives and the number of people that you've tested impact the decisions that you're making and how they input into the exact models that are being put out there, like having a super strong opinion on this stuff, participating in this conversation makes you kind of look foolish, and you don't even realize how foolish it makes you look. But you know, gosh, and I feel such a hypocrite saying this. So specificity, prevalence, and God, I keep forgetting the other term here. Sensitivity, specificity, and prevalence are the 3 terms. And we talked to someone at the Mayo Clinic specifically about this. So without really understanding those terms and pretending that you were out there doing a ton of research, you don't know what those terms mean. You don't know exactly, what a virus is compared to bacteria, or the difference between coronavirus and flu, or in this case, you didn't read the CDC guidelines that Dr. Scott Jensen used to create this conspiracy theory. Man, it's weird for you to be participating in these conversations with such a narrow amount of data. Because I think things are massively changing here, and not that we are out of the woods. I think people still need to social distance. They still need to be washing their hands, trying not to face touch. I have a feeling I've touched my face 100 times already during this video. And most importantly, wear a mask in public and when you're around people that you don't know. If you're doing those things, it's going to help a ton. And we're actually seeing it a ton based on basically country to country, the people who are adhering to these guidelines and the ones that aren't, and the states that are and aren't. We're seeing these kind of numbers, and Minnesota is going to have some numbers here in a month that are going to be very telling. And we said this a month ago, and we're seeing a lot of the protests. And so we're seeing an increased number of cases, but not in ICU totals. But we'll see. But I feel like the show has become very redundant here. Lunatics, say something crazy in the comments that I can react to. But there's one other thing that I wanted to share from chief fact checker Josh Kimber here. So let me share my screen one more time, because Mike Loaf and I talked about this briefly last week, I think, in many different ways. And I've been talking to a handful of parents who have children in school that not going to school in the fall is just going to have these massive impacts on families, on education, on mental health, and setting potentially the American education system backwards. I don't even understand, because I didn't get a chance to look at this. Chief fact checker Josh Kimber sent this to me just a couple of minutes before the show. I don't even know if Trump has the ability to cut funding, because I thought schooling was a very state issue. So we'll see what happens there. So Lunatics, go ahead and chime in the comments here if you think this is going to happen. But one of the things that I've had this conversation with a couple of parents that I know send their children to private school. I have a feeling that there's going to be a little bit of a shift towards some private schools during this time. And I don't know what kind of capacity these private schools have. I don't know what kind of risk that resuming the school is going to have on the staff, because it seems like the actual risk is, or at least the direct risk would be to the staff. Because as I think we're still at one death in the United States of somebody that was under 17 years old, but he was diabetic and morbidly obese. Like I think he was like a 400-pound 17-year-old. And correct me in the comments here if I've got this completely wrong. But the shift, and I've talked to a couple of parents who send their children to private schools, it seems to be like they are moving towards opening the school, and they're trying to figure out a way to minimize the threat and risk to the staff that are the most at risk, and then trying to do some sort of measure to prevent some sort of spread of the disease among the students there, because it's going to be completely unmanageable. But you know, having some sort of distance learning opportunity for the kids that can do that, multiplied by the ability to maybe do some sort of social distancing enforced in a loose way in school, in these schools, seems to be coming. And it's only going to happen to private schools because clearly the state is probably leaning toward, at least most states are probably leaning to not reopening and not, or having some blended distance learning and in class or in-person class and schooling. So we'll see. From his insurance salesman job over. Well, loyal lunatic Jonathan Ogren's got a comment here about the Costco rant guy got fired from his insurance salesman job over something. I remember seeing the Costco thing, but I'm not sure if you're talking about the Costco customer, patron there, or if you're talking about the employee. And I'm guessing it's the actual rant, the customer there. So I'd love to hear your comments on that, Jonathan. But as it relates to schools, and I've seen this, and I think maybe it was Chief Fact Checker Josh Kimber who said something about a private school and the interesting nature of that, because I can see a lot of parents just biting the bullet and moving their kid to a private school if there's capacity to do that. To return to some sort of normalcy if they themselves don't feel like they're at risk, they're doing a good job kind of continuing to social distance and quarantine themselves from the people who are most at risk. I'd be very curious to see how all of that goes. And in fact, I'm going to ask the lunatics here, would you consider moving your children to a private school if it opens in the fall? Yes, no, depends on a lot. So I'm throwing this up in the hotlou stream, but yeah, would you consider moving your children to a private school if it's planning on reopening in the fall and you're not sending them to a private school right now? I'd love to hear your thoughts, even if you aren't a parent. You know, if you were in that spot, would you consider moving them, even if it meant costing you a little bit more, and seeing how that kind of changes your life? Nice. You know, the last thing I want to say is one thing I've really enjoyed is, and this is the headline that I saw, was thehill.com. So thehill.com has something with Crystal Ball and Sagar that, and I forget the name of it. It's called like the morning something, or this morning or something like that on YouTube. I think they do a really good job at being very straight down the middle, or at least they avoid most of the extremes and make fun of a lot of the extremes. And it's one of the few voices that seems to be really kind of reasonable in the middle. Maybe I have that completely wrong, but you know, I've actually enjoyed a lot of the coverage that I'm seeing from The Hill and the YouTube channel that I mentioned. So we'll throw that in the show notes, but I'm curious if you've been reading this stuff, lunatics, and whether or not you've enjoyed it. And like I said, we have somebody who's got a newsletter that we're just scheduling. I'm hoping in a week we'll have him on. He's got a very big newsletter called Tangle that he's out there trying to build a really big newsletter list on it, and we're going to promote him. His name's Isaac Saul. I'm looking forward to talking to him too. And I might as well throw this out there. I've been noticing all of you lunatics are out there liking, commenting, sharing, reacting to the videos a lot more. And like I said, it helps way more than you realize. And I'll remind people that this is available on YouTube. It's available on Twitter. It's just on my main Twitter at hotlou. But if you Google hotlou Happy Hour YouTube, you'll see it right there, and you can subscribe there and watch it there. If it's a little bit easier, because I know it can be hard to find some of the replays here, but check that out. It's been awesome, and I'm feeling like we've been maybe a little bit repetitive here over the last couple of days, and it's been a challenge with the schedule, with my travel and with Mike Loaf's travel. But we're going to start resuming a very more regular schedule here, teeing up a ton of interviews as I keep teasing, and that'll, I think, maybe make the show feel a little bit less repetitive. But I really appreciate all you lunatics checking in again to maybe a bat-free episode, excluding Mike Loaf's background as a bat out of hell. But maybe we'll have a bat resume at some point. But thanks everybody for tuning into today's hotlou Happy Hour. Tomorrow, I think it's going to be pretty normal. So I hope you'll check in then. Whether it's on Facebook, YouTube, Twitter, or wherever. So thanks again, everybody, for tuning into today's hotlou Happy Hour. I'm your host, hotlou, and we will talk to you tomorrow.